Hi, my name's Zaynab. I'm a third year medical student at the University of Sheffield, and I'm currently undertaking a placement with Mr. Abdul at the Delta Centre. Today, I'll be giving a presentation on DVT prophylaxis and specifically considering surgery. The things I'll be running through is what is DVT, the risks posed by surgery, factors that can affect DVT risk, and prophylaxis methods. Now, starting with what is DVT. This is a short form way to say deep vein thrombosis, and it's a serious medical condition where a thrombus can form in the deep vein, usually in the calf, thigh, or pelvis, which is in the legs. Some symptoms that tend to be main symptoms are leg pain, swelling, which is normally unilateral, so one leg will be noticeably larger than the other, redness, warmth, and tenderness. A significant complication is that the clot can embolize and travel up to the lungs, which can cause a pulmonary embolism, and this is a life threatening medical emergency. It is also important to note that pulmonary embolisms and deep vein thrombosis are both types of venous thromboembolisms, also known as VTE, and VTE may be used interchangeably with both these conditions. Now, how can surgery impact your risk of developing a DVT? What we need to consider here is virtuous triad. Virtuous triad are the factors that ultimately increase your risk of having a thrombosis. So this includes stasis of the blood, endothelial damage, and hypercoagulable state of the blood. Now, when thinking about surgery, one of the main factors is immobility. So, surgery is associated largely with immobility during the surgery and also post surgery in the recovery state period. Now, immobility can affect your risk because of the stasis of the blood, which is a factor in virtuous triad. Another factor is increase of clotting factors. So, with surgeries, especially in major surgeries, the body will respond to the excessive bleeding by increasing your clotting factors. This makes your blood more hypercoagulable and therefore increasing your risk of having a DVT. Now, some factors that can influence your risk overall of DVT in surgery. Now, you get some surgical factors and also some patient factors. So, with surgical factors, that may be the type of anesthesia used, the type of surgery, and post operative mobilization. So, with type of anesthesia, of course, general anesthesia will pose more risk. It has more physiological impact on the body. And where possible, we will use anesthesia which has lower risk. Type of surgery, of course, longer surgeries, major surgeries, are associated with more risk as they will have more impact on the body and will likely be more impacted. With post operative mobilization, it's important to ensure that patients are mobilizing after their surgery as much as they are able because this will reduce the risk. With some patient factors, we have age, so DVT increases with age, obesity, previous VTEs, and any pre existing conditions. These all influence your overall risk of having a DVT. Now, running through prophylaxis methods used. Of course, the reason we need prophylaxis is because of the life threatening complications that may occur from DVT, such as pulmonary embolisms, like we mentioned. The prophylaxis methods can include mechanical methods, pharmacological, and general advice such as early mobilization. Starting with mechanical prophylaxis, this can be graduated compression stockings, which is shown on the left, or intermittent pneumatic compression, shown on the right. Essentially, these both use compression, and compression causes a pressure on the legs, which will prevent blood pooling and therefore prevent any venous blood stasis. And that ultimately will reduce your risk of having a DVT. Moving on to pharmacological, there are a few medications that may be used that can be low molecular weight heparin, normal heparin, and DOACs. Now, the different choice of which pharmacological prophylaxis to use can be dependent on either the type of surgery, suitability for the patient, and the overall local policy in your trust or in your hospital. Things to mention is low molecular weight heparin is usually taken as a subcutaneous injection. Now, all these medications have direct impacts on the coagulation cascade and therefore will affect the coagulation ability of the blood. So ultimately, we are trying to really reduce the coagulability and prevent a DVT in that way. And moving on to lastly, early mobilization advice. It's important to advise your patients post surgery on what will reduce their risk. So the main thing would be to prevent immobility and make sure they are getting mobilized as early as they are able to. Now, just to conclude, DVT is a serious medical complication which has an increased risk of occurrence when you undergo surgery. There are different methods of prophylaxis, which include mechanical methods and pharmacological methods, and they should all be considered with patients undergoing surgery. Thank you so much for listening.